So my name is Michelle Lane. I am the Senior Director for Community Health and Wellness here at North Kansas City Hospital. And it is absolutely my pleasure to welcome all of you to this informative session. It's hosted today by Meritas Cardiology. Today, we have the privilege of hearing from an esteemed member of that medical team. Her name is Emily Lynch. She is a highly experienced nurse practitioner who has dedicated her career to advancing cardiovascular health. Emily Lynch brings a wealth of knowledge and expertise to our discussion today. She has a really strong background in cardiology and has really been at the forefront of patient care, specializing in the management and prevention of heart disease and heart failure. In today's talk, Emily is going to be addressing a topic that affects millions of people worldwide, and that's blood pressure. Hopefully, she's going to be able to shed the light on critical importance of maintaining healthy blood pressure levels, the risks associated with high blood pressure, and practical strategies for effective management of blood pressure. Her insights will not only help us understand the complexities of blood pressure, but also empower us with the knowledge to make healthier lifestyle choices. So without further ado, please join me in welcoming Emily.
Hi, thank you, Michelle, for that introduction, and let's get started. All right, so as Michelle had said, blood pressure is very common. You can read this slide here and see it's the most common primary diagnosis in America, accounting for about 35 million office visits per year. So pretty significant. So what is your blood pressure? Blood pressure is the force of blood pushing against your arteries. It's measured in two separate numbers. The top is your systolic and the bottom is your diastolic. Systolic is that contraction or beat of the heart, and diastolic is the relaxation or that pause between beats. I think that kind of just mirrors what I said. All right, so what we need to know is what is high blood pressure and what's a normal blood pressure. So normal is defined as that top number, a systolic number being 120 or less, and the bottom number or the diastolic number being 80 or less. Once we get between 120 and 129, it's considered elevated, but does not carry that diagnosis of high blood pressure. It's just a good reason to kind of keep an eye on things and maybe check your blood pressure more regularly at home. And we'll kind of get to how we do that in some slides that are coming up. High blood pressure or stage 1 high blood pressure would be numbers on the top of 130 to 139 and that bottom number 80 to 89. Again, another good reason to monitor your blood pressure closely, but readings like this would probably prompt us to see you back in the office in about a month with a blood pressure log and potentially start blood pressure medications if at home your blood pressure is running in the 130s on that top number or in the 80s on that bottom number. Then we advance to what we call stage 2 high blood pressure, which would be numbers on the top greater than 140 or greater than 90 on the bottom. Kind of the same theory as that stage 1. We would monitor over a couple of weeks and likely be initiated on blood pressure medication if we were getting readings that high on a regular basis. And then hypertensive crisis or blood pressures that are reaching up to that 180 over 120 mark, we wouldn't delay in those instances. It's time to start blood pressure medication. And certainly if you're getting readings that high on your own at home or at the pharmacy, those are really good reasons to reach out immediately to your primary care doctor, or if you already see a cardiologist, to reach out to that team as well, because we're not going to delay starting on medication in those instances. All right, so how do you measure your blood pressure? We're lucky you can pick up a blood pressure cuff at a local pharmacy, at Walmart. They're pretty easily accessible. There's 2 different kinds. You can get one that goes on your wrist, or you can get one that goes on your upper arm. I usually recommend that you check them against another blood pressure cuff when you do buy one. So you can pick up a cuff at the store, and then typically pharmacists or pharmacies will have a location that you can check your blood pressure. And it's always a good idea just to make sure that cuff that you purchased matches another blood pressure cuff at your local pharmacy. Occasionally you will see that those cuffs that you purchase are not accurate. Not very often, but it's always a good idea to make sure that they correlate with another machine. So a good rule of thumb when you're checking your blood pressure at home is avoiding caffeine, exercise, smoking or drinking alcohol prior to, at least 30 minutes prior to on caffeine, exercise, and smoking. And then you want to be totally relaxed for at least 5 minutes before you check it. So we want you sitting down in a relaxed location, no bright shining lights like I have on me right now. You're not talking to anybody, you're not watching the news, you're not playing on your phone. Your feet are both steady on the ground, your back is straight, and you've kind of just reached as much relaxation as you can in that 5 minute period of time before you check your blood pressure. We don't want to see you outside weed eating your garden and then coming right inside checking your blood pressure. It's probably going to be a little higher than normal. Another important thing is making sure you have an appropriate sized cuff. If the cuff is too small, you'll likely have a falsely elevated blood pressure reading. And subsequently, if it's too loose, you're probably going to get an inaccurate reading as well. And then keep a record or keep a log of it. It's a good idea to try to check it at the same time every day, typically the morning. I usually tell patients if for some reason you can't do that, there's typically a comment section where you can write what time of the day that you took it. And if there was something going on outside your control that was causing a little bit extra stress, or if you couldn't reach that tranquil state that we talked about earlier, it's a good idea to make a comment to the side over there. These are some pictures of the different kinds of blood pressure cuffs that you can buy over the counter. So the first one you see there, that is a wrist blood pressure cuff. He's demonstrating a good way to use it there on his left wrist. He has it held up at heart level, and he should be sitting down and relaxed when he's taking that blood pressure. The next one over there, that guy's demonstrating it perfectly. You can see he sat up straight, his legs aren't crossed, his feet look like they're probably on the ground, his back is straight, and he has his arm relaxed there. He doesn't have it up high or holding anything. He's doing it perfectly. And this goes over a lot of the same stuff we just talked about, tips for an accurate blood pressure reading. So again, not drinking alcohol, having caffeine, exercising, or smoking 30 minutes prior to. We're sitting in that chair totally relaxed for at least 5 minutes. Not talking on the phone, not watching the news, not talking to another person. Another strategy that you can implement is checking your blood pressure a second time. So waiting a few minutes and rechecking your blood pressure. And you can kind of average those numbers together. So those top numbers you can average together, those bottom numbers you can average together. And if you're so inclined to check it twice, then you can write that number down to go over with your healthcare provider as well. And that can help things. So there are two different kinds of high blood pressure, or two categories, I should say. Primary high blood pressure is the most common type of high blood pressure, which essentially there is no established cause for the high blood pressure. There's no secondary diagnosis. The less common are secondary high blood pressure, and it accounts for about 5 to 10% of diagnoses of high blood pressure. And things that can cause a secondary high blood pressure could be medications like birth control, NSAIDs, stimulants, diet pills, or immunosuppressants, autoimmune disorders, endocrine disorders, thyroid problems, problems with your kidneys, and untreated sleep apnea, probably one of the most common reasons for high blood pressure, or secondary high blood pressure, I should say. So risk factors that you can control: your eating habits, your weight, diabetes, how much you exercise, toxic behaviors like smoking cigarettes or drinking alcohol excessively, and high cholesterol. Difficult to control risk factors. That's going to be our genetics, family history of high blood pressure, our age for men older than 55 or women older than 65. These are risk factors. Certain ethnicities have a higher prevalence of high blood pressure, chronic kidney disease, and then like we talked about, sleep apnea can put you at risk. And we can treat sleep apnea, and that can certainly help. complications of prolonged uncontrolled high blood pressure is going to be changes in the vessel walls or trauma to your arteries or your vessels. And that trauma can lead to weakening of those vessels. And that can, of course, lead to a stroke. And then the trauma to vessels can predispose you to building up plaque in those areas. And that plaque, of course, can lead to things, again, like stroke and heart attack. There's also some target organ dysfunction, such as damage to your kidneys or the vessels in your kidneys, which can cause problems in how your kidneys function. And then there can be damage also to the small vessels in your eyes. I think here this kind of mimics what I had said previously about potential damage to the blood vessels in your heart, your kidneys, your eyes. So what is our goal? Our goal is to keep your blood pressure less than 130/80. We can try to do that first with those modifiable risk factors like we talked about earlier, like smoking cessation, exercise, and weight loss can have a pretty dramatic impact on your blood pressure. But ultimately, if we're noticing a sustained blood pressure of greater than 130/80, starting on medications to lower your blood pressure. And over time, if you're able to modify certain aspects of your life, then hopefully we can get you off some of them. But overall, the goal is to get you to that goal blood pressure as soon as we can, so we can reduce cardiovascular complications and complications with your kidneys and other organs like we talked about previously. And again, treatment benefits, reduction of stroke risk, heart attack, heart failure. And these are some of those lifestyle modifications we talked about. Out to the side here, you can see what kind of reduction you might expect to see in that top number or systolic blood pressure with these modifications. So you can see the biggest impact you can have would be weight reduction. And then eating healthy, avoiding foods that are high in sodium, things like prepackaged food, fast food, physical activity, exercising, of course, is going to help with that first modification, which is weight reduction, and then reducing the amount of alcohol we consume. And again, this kind of mirrors what we talked about in the last slide, these lifestyle changes here. And then follow-up on blood pressure. So a normal blood pressure, recommended follow-up recheck in a couple of years. I think that most of us do a good job of seeing our primary care doctors once a year. And if we're not able to get in to see them, again, we're lucky that we have access usually to blood pressure machines at local pharmacies. So pretty easy to drop in and check your blood pressure on a yearly basis. Of course, if we're noticing those pre-hypertensive numbers, like we talked about earlier, that top number greater than 120/80, then we might make the decision to start checking our blood pressure a little bit more frequently. But certainly, if you notice a blood pressure greater than 130/80, it's a good reason, like we talked about earlier, to get a log, buy a blood pressure cuff for at home, and be checking your blood pressure more frequently and keeping that log so you can discuss it with your provider at your next appointment to see if maybe the right choice for you is to start medication for high blood pressure. There are some free blood pressure checks locally, like we talked about. And then every Wednesday, the Gladstone Community Center will check blood pressure as well. So that's a good resource for you. This is a little check sheet made by the American Heart Association that you can fill out prior to your appointment with your healthcare provider to get the most out of your appointment. This is a great sheet. Really kind of streamline things so nothing's forgotten during those appointments. You don't forget to ask any important questions. All right, any questions from anybody?
Looks like we have one question, and the question says, sometimes I've been told to take my blood pressure in both arms. Why?
Yeah, so it's not a bad idea to take your blood pressure in both arms. There are a couple of diagnoses or phenomenons that can cause you to have a lower blood pressure in one arm, so maybe not an accurate blood pressure. So if there's ever any question about that, then yes, certainly you might be told to take it in both arms for some period of time, usually not an extended period of time. But yeah, for the first couple of readings, checking it both arms isn't a bad idea. and then just noting if there is a big difference in those two arms readings. And that's a good thing to talk to your healthcare provider about as well.
Okay, and one other question, it says, why would I be standing or sitting? Sometimes the doctor checks my blood pressure in different positions.
So there are some conditions. So orthostatic hypotension is a condition where your blood pressure changes with position changes. And it can kind of complicate that picture for patients who have high blood pressure. It can make high blood pressure a little bit more difficult to treat if you go from lying, sitting, and standing, and your blood pressure drops significantly. Typically, if that's something that you're suffering from, symptoms you'll have will be dizziness or lightheadedness. Those are always great things to bring up to your healthcare provider. Certainly, if you have a diagnosis of high blood pressure or you're pre-hypertensive, or if you're on blood pressure medications, it's always a good idea to tell your healthcare provider if you're having dizziness or lightheadedness, and that might prompt us to check your blood pressure lying, sitting, and standing, because that could lead to a secondary diagnosis.
Okay, I got a thumbs up for that, so that made sense. Looks like that's all for our questions. That was so helpful. Thank you so much, Emily. We appreciate your time today and your expertise on this great topic that affects so many people. For more classes and upcoming blood pressure screenings in the community, just go to www.nkch.org/classes. We'll be at Liberty Community Center and at 10 farmers markets coming up in June and July. So we'll also be doing cholesterol screenings, hemoglobin A1Cs for free at these farmers markets. So come check us out, and thanks so much, everybody. Have a great day.
Thank you, guys.